Good day. I'm Dr. Gary Raskob, Dean of the Hudson College of Public Health at the University of Oklahoma Health Sciences Center. Pleased to welcome you to this virtual town hall on COVID-19, an update for the OU community. And it's my privilege to present this on behalf of the OUHSC Special Pathogens Preparedness Operations Team. Now, our town hall today will have two parts. First, we will do a brief overview of the COVID-19 virus and pandemic. And then secondly, we will talk about lessons learned and how we can apply those lessons to protect ourselves, our families, and our community from infection with COVID-19. COVID-19, also goes by the other name listed here in the slide, is a new virus. Humans have no immunity to it, and this has been a critical factor in its rapid transmission and spread across the globe. Now, the known timeline of the outbreak and pandemic of COVID-19 is shown in this slide and the next slide. It's believed that this virus and transmission of this infection began in the open-air market of Wuhan, China. The first case in the United States was diagnosed on January 23rd. February 24 to 26 is an important milestone because this was the first case in the United States with no known exposure, either travel to areas that were known to be endemic with COVID-19 or exposure to other individuals who were infected with COVID-19. This means that we had community spread in our country, and that's very important with respect to the strategies for how we contain this virus and mitigate its impact, which will be discussed later in the town hall. Oklahoma's first case was documented March 7th, 8th, and since then we're now up over 60 to 70 cases or more. The exact number changes daily, and you can see these two websites at the bottom of this slide provide good websites for you to keep up to date on the number of cases across the country and state by state and in the globe if you're interested. Coronavirus really refers to a large family of viruses that can infect humans or animals. These infections in humans typically occur in the winter and spring, and coronavirus is a common cause of the common cold, responsible for about 10 to 30% of common colds in the United States. Sometimes these viruses can jump from animals to humans, and this is likely what's happened with the COVID-19 virus. COVID-19 is transmitted by person-to-person spread among close contacts. So by close contact, we mean when you are in contact with an individual within 6 feet or less. The virus is transmitted through respiratory droplets that are produced when a person speaks, coughs, or sneezes. These viral particles can travel about 3 feet from a cough, and they can contaminate surfaces also, such as your keyboard, your mouse, doorknobs, and so forth. And these droplets, when people are in close contact, can land in the mouths or noses of nearby people, or possibly can be inhaled into their lungs. And this is how we transmit this infection from people to people. Now, the relationship between transmission and symptoms is summarized here. We have two types of transmission here. We have pre-symptomatic transmission. This is when a person who is infected but not yet showing symptoms can transmit this to somebody else. And for COVID-19, we now know that the time from one person who's infected to transmit to a second person is on average about 4 days. You'll see the importance of that in a moment. There is also the possibility of asymptomatic transmission, quite clearly a person who never shows symptoms of COVID-19, but who has the virus, carries the virus, and can transmit it to someone else. And these two elements are what is making the control of this infection really, really challenging. Now, when symptoms occur are about 2 to 14 days after exposure or infection with the COVID-19. About half of people will develop symptoms within 5 days. The common symptoms are fever, cough, shortness of breath. But there are other symptoms. None of these symptoms is individually indicative of COVID-19. They can occur with many other upper respiratory infections and other conditions. And this is what makes the diagnosis challenging and depends on being able to do a laboratory test to confirm the presence or absence of the virus. There's no current vaccine for coronavirus COVID-19. There are no specific antiviral drugs to treat it, in contrast, for example, to flu, where we have a common known drug called oseltamivir or Tamiflu. And for hospitalized patients, then the treatment is largely supportive. Then, therefore, the best way to prevent COVID-19 illness is to avoid being exposed to the virus. And that is critical and underpins everything we're going to talk about in terms of our strategies to prevent ourselves and our family and community from becoming infected. Now, there is a diagnostic laboratory test for COVID-19. Its availability in the United States has been limited and slow to roll out, but as I'm talking to you today, March 23rd, I think we'll finally be seeing a breakthrough in increasing the capacity for diagnostic testing, laboratory testing over the next several days. When we have a positive laboratory test, we can say that the person has been infected with COVID-19 virus. However, a negative test in some situations just doesn't provide the evidence that the person's infected, but sometimes we need to have more than one negative test, and we'll talk about that in a moment. So when a person comes with symptoms of COVID-19, the best way to know about the infection is to do the laboratory test. When people have no symptoms, the accuracy of the test is presently uncertain. Quarantine and isolation are terms used synonymously in our general language, and we usually do this for people without symptoms who've been exposed to keep them from exposing others, or for people with symptoms to keep them from exposing others. Now, the length of isolation in those with symptoms is generally for 14 days, and this is to cover the range of time generally with respect to the period of this virus. Now, when a patient recovers from COVID-19, as many do, then usually now doctors will require that person to have a negative laboratory test indicating they're no longer shedding the virus, and they may require that on more than one occasion, on 2 or possibly even 3 times, to make sure that the person has completely cleared the virus and is no longer infectious. And now, we can talk about the severity of COVID-19 infection. We use a couple of different terms. Case fatality rate is the probability of death among those who are diagnosed with the disease. Globally, this is about 4.2%, but it varies across different countries. And we see here notably that in Italy, it has become quite high. In the United States, currently it's around 1.5%. It varies by state. And interestingly, here we see stark differences between Washington, where a heavy amount of the burden of infection was in nursing home individuals who were more elderly and had other underlying health conditions, versus New York, where there has been much more extensive documentation and testing of the condition in the general population and more mild cases. This virus is highly transmissible. We use a number called the reproduction ratio, or R0, which is the average number of people that a person with COVID-19 infection will go on to infect. And that's about 2 to 3 for COVID-19. So every person with COVID-19 may then go on to infect 2 to 3 others. Well, what have we learned from following this pandemic and studying it over the course of its evolution over the last couple of months? we've learned a few important things. COVID-19 is not influenza. It's more severe than seasonal influenza. It's not just a bad cold. It has a higher case fatality rate. It's much more transmissible, transmitted easily between people. So even though there are more influenza deaths each year throughout the country, that's because the influenza infection's been with us in society for much longer and has had decades to circulate the earth. COVID-19 has only been around for a few months. And so this is a serious infection for about 20% of the people who contract it. And our goal is to prevent COVID-19 from becoming as common as influenza in our population. Now, the public health response to this has been varied in different countries. Initially, the hope was to contain this by isolating people who have been infected, symptomatic cases. Once it was learned, of course, that there is pre-symptomatic and asymptomatic transmission, this strategy really will not completely contain the virus. It's still important, but it won't completely contain it. And that's why public health authorities have moved on to a strategy of mitigation. And that means we're working to prevent as many exposures as possible to dampen down the impact of this pandemic, to reduce the total number of cases, to reduce the mortality and the morbidity from the infection, and to limit the number of cases so that we don't overwhelm the health care system, which we'll say more about in a moment. Mitigation means we cover our cough and our sneeze. We have proper cough and sneeze etiquette. Avoid touching your face because that's when you can transmit virus from surfaces into your nose or mouth. Wash your hands repeatedly, regularly. Take personal responsibility because it's not only your health that's important. If you're a young person, particularly our young students, if you get COVID-19, you may well have some mild symptoms for a few days and then recover, but that's not okay to say, well, I'm not worried about this, because COVID-19 can be transmitted to others. You may be a person who is asymptomatic, carries this virus back into your family, into your circle of friends and your circle of associates and our community. So everyone has to take personal responsibility for their part in the mitigation, which we'll talk more about. Social distancing is a crucial element of this. That means we're going to keep a distance between individuals of at least 6 feet and a number of other strategies. And we are going to isolate and, if necessary, enforce quarantine on known cases of COVID-19. Now, when this is done very aggressively and properly with good collaboration and compliance by our community, we see that this can really impact the pandemic. And the two examples of that are the no new cases in Wuhan, China. Finally, after March 19th, was the first report where it seems that no new cases were continued to be reported. And I think more importantly, in Korea, you see that there was an increase in cases, but then as aggressive mitigation approaches came into effect, this dropped way off, and we are able to mitigate and limit the impact of the infection in our community. Now, countries have responded differently to this and gotten different results. China was slow to react initially, but when they instituted aggressive measures, they started seeing a drop in the number of new cases. Iran had thousands of cases each day, and that has been devastating. Italy was relatively lax in the beginning, and then cases skyrocketed. The health system is overwhelmed, and they have a high case fatality. And as I've mentioned, South Korea was the first country outside of China to really bend the curve through aggressive prevention measures. What do we mean by bend the curve? Well, these are the curves, the graphs of the total number of cases on the vertical and the time after the 100th case in that country on the horizontal. And we see how that progressed for Italy, Iran, Spain, Germany. And what you see here is that, let's just contrast Italy, which saw a progressive, rapid increase of cases, and you see it continually going up here, and this is data through March 17, whereas South Korea, when they implemented aggressive prevention measures, was able to slow the slope, dampen the slope of this curve, bend it down, and flatten it like this. And that is critical. And the United States is now at a crucial inflection point in the progress of this pandemic, where our hope is to take such aggressive measures, mitigate the pandemic, so that we can bend the curve for our country and follow this curve, or even better, maybe downward, like Korea, and not become Italy. And you see also that these other countries took even more aggressive measures very early on here, and we were able to push down the number of cases and the impact of in their countries of the pandemic. So bending the curve is crucial. The United States and Oklahoma, we are at a critical point now, and that is why we are taking these aggressive social distancing measures and really stepping this up. You should clean your environment. COVID-19 virus is a pretty hardy virus. It can live on surfaces for days. Don't assume the virus is dead just because it's been a few hours or days. So actively disinfect things you touch. You need to use the standard cleaners that say 99.9%, kills those germs. And on a regular basis, once or twice a day, maybe clean your surfaces, your keyboard, your mouse, some doorknobs, some other things that are commonly touched. The flush handle on the toilet particularly is a common source of transmission, not only of COVID-19, but of other infections. So actively disinfect these things. Wear gloves when you do this. Disinfect, wiping these things down, throw those things away, and then wash your hands. Practical tips: wash your hands with soap and water for at least 20 seconds. Do this on a regular basis. If we are all distancing to remote locations for work, for study, for other things, if we're doing that social distancing, including working remotely and so forth, then you'll typically have the ability to be within distance of a sink and a faucet and so on, and wash your hands. Wash your hands regularly. Washing your hands will be better than sanitizer. Sanitizer really has a role for if you are traveling or in a place, or you have to work and you're essential and you can't get to where you can wash your hands, or immediately after, say, you put common things like putting gas in your car or various other things. The hand sanitizer is good then to prevent you transmitting that to other things you touch before you get to opportunity to wash your hands. Cover your cough or your sneeze into your elbow, or use a tissue to cover your cough and sneeze, then throw that tissue away and wash your hands. If you are not feeling well, there are resources on each of our campuses listed here. Please call. Regarding recommendations and guidance, again, the effort to mitigate the transmission of this virus in our community is the rationale behind why there is no university-sponsored travel until further notice. Please check with your supervisor, your dean, if you have questions. We strongly discourage you from traveling by air or by other means that bring large groups of people together, train, bus, for example. And if you do that, be prepared to be isolated on your return, because you may be traveling to other areas where there is a lot more COVID-19 infection in the community than we may currently have. But social distancing is crucial. Limit close contact. Stay 6 feet away from a personal distance. Respect that personal distance. Classes and meetings now are best held by remote learning approaches. Minimize gathering in groups, and a number of events, both university events and community events, of course, have had to be canceled for this reason. This may be stressful as we go through this. It will go on for a little bit more of time, probably weeks. This can cause fear and anxiety. Please, if you're having these types of emotions or you just need to talk, reach out to student counseling or the employee assistance program. You can stay informed, and being informed is a great way to help protect yourself. Panic is not called for. If you take this seriously and rationally, we don't have to panic. Follow the directions issued by the university and your program or college. Check your email regularly and the website for updates and communications from the university. And please do your part. The President of the United States on March 16th released the guidelines for America. This is very important. Please, please listen to and follow the directions of your state and local authorities. These guidelines and recommendations are not taken lightly. They have very good rationale and purpose, and we all need to do our part as a community coming together. If you feel sick, stay at home. Don't go to work. Don't go to school. Contact your medical provider. If you have symptoms of coronavirus, call first. We don't want you going into the emergency department or directly to the clinics or the health centers or urgent cares, because we don't want the possibility of exposing other people or healthcare workers. Call in and you will get clear instructions. If your children are sick, keep them at home. Don't send them to school. Contact medical provider. If someone in your household has tested positive for the coronavirus, it's important to keep the entire household at home. Don't go to work, don't go to school, and take advice of your medical providers. Particularly older people over age 65, please try to isolate and shelter at home and away from other people as much as possible, because so far it's in this group of people where the most serious consequences of the COVID-19 virus can occur. It's not that they're more likely necessarily to be infected. In fact, half of the cases in Oklahoma are between age 18 and 50. It's just that you're more likely to have a serious consequences, bad pneumonia, and other bad serious consequences of the infection, especially if you have other underlying health conditions. And if you're a person with a serious underlying health condition, stay at home and away from other people. Well, thank you very much. We hope that this has been useful to you. Again, I want to say that I am presenting this on behalf of a wonderful team. We want the OU community to really know that there is a group of people who are working 7 days a week, many hours, to do this. And the contributors to this town hall were many and are listed in this slide, and I'd like to thank and recognize them. And I want to thank them for their hard work each and every day as we work through this. I want to give particular special mention to Dr. Aaron Wendelbo, who took the lead on developing the initial drafts of this presentation. Thank you, and we wish you good health, and let's all work together, and we will get through this, this COVID-19 infection in our community and be stronger as a community when we come out of this. Thank you very much.